So for those of you that do not know me, I am Bob and Dottie Young's little boy, or I am John Young, medical doctor here at Foundational Health Center. And Tiffany and I, who you'll meet in a few minutes, who's my other nurse practitioner, we each have a lot of topics, and today mine is stem cells and Umbilical. So we're going to start out with stem cells. And I hurt my knee, my left knee, because I play tennis like crazy all the time. And I hurt it about 9 years ago. And I did everything. I did platelet-rich plasma, I did chiropractor, I did massage, I tried all kinds of herbs. It never got any better. And out of the blue, a gentleman came into our office and said he was here to talk to us about stem cells. I said, I am not interested in stem cells. They come from aborted fetuses. No, 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 no. The federal government, the FDA, has now authorized the use of umbilical cord stem cells, no dead babies, nothing like that, to be used. It's all under the auspices of the tissue banks. And these cells can be used by physicians to treat a number of different conditions or illnesses. So they talked about this use in injuries, knee injuries. I had done an MRI. I had 4 meniscal tears. I limped around the office. The left knee was swollen. Hadn't played tennis in about 4 months. And I put the stem cells in there. My nurse did. And you know what? The next day, I was no better. Boy, did my knee hurt. But after about a week, I found out that I could get in and out of a car without having to stretch my knee slowly to open it and close and whatever. And after about 3 weeks, all of a sudden, all the knee pain was gone. The swelling was gone. I was very careful. I just hit the tennis ball off a backboard once or twice a week, didn't run. After another month, I took 2 steps on a tennis court just to keep hitting, did not run. And after 3 months, I went back to full-time tennis. As one of the players that I hit with a lot said to me, John, you drive me crazy. You're faster today than when I first played you 5 years ago. I did a MRI, and it showed that those 4 meniscal tears, 3 were completely gone, and the 4th one was 80% healed. The bone on bone, which all the orthopedic surgeons say you cannot regrow meniscal tissue, all grew back. Arthritis was gone. That was 8.5 years ago. I'm a pretty happy boy. I play a lot of tennis, at least Mondays, or at least Friday, Saturday, and Sunday. I'm on the court 4 to 5 hours a day at times. So that was my initiation to stem cells. And my patients started seeing me walking around the office without limping. And so I started doing more and more stem cells for joints. I did it for hips, knees, ankles, shoulders. And I was completely surprised at how well this worked. And patients that were just told by the doctor, either you have to do major surgery or you're out of luck, they were getting better. It's about an 80% success rate. After a while, people came to me and said, what about stem cells for some other conditions? And so what I did is I had a lot of people with back problems, cervical disc disease, lumbar, L4-5 disc or shot. Surgeons gave them pain medicines, didn't want to do anything. So I started injecting the disc at the back and in the neck with stem cells. And after about 4 to 6 weeks, the patients would notice that their neck was better. And many of them didn't have to go for surgery. It was about a 75% success rate. Then I read an article about stem cells used by the Germans back in the 70s to treat Down's children. When they treated them with stem cells, there was a 20-point increase in their IQ. So my daughter, Catherine, was 6 years old at the time, and I gave her umbilical cord stem cells. Little nervous, gave it to her as an IV. 72 hours later, a completely different daughter. Very engaging. Her brother would like bug her, and Catherine would just, instead of saying, stop it, Jonathan, I'm trying to color. Started to have conversations with us. And we did exactly what they did in the German studies. She got stem cells about 3 to 4 times a year. It was very interesting. Every time she got them, about 72 hours later, you would see her just go up another level intelligent-wise. And we never told her teachers, but the teachers would come back and say, Catherine's a little bit different. What's going on? Oh, we gave her stem cells. And she's been doing that. She's 11 years old now. And a couple of interesting things. First of all, we were told she has a terrible immune system and will be open to infections all the time. So get used to antibiotics all the time. Oh, wait, she's 11 and never been on antibiotics. Because stem cells will remake an immune system. And it's just been really gratifying to taking a girl that was classified by the Pinellas County school system as highly uneducatable, a great social butterfly, but no educational potential, to the teachers' report cards now, very educatable, still a social butterfly, but showing great ability to memorize, to learn things. And the only really thing we did to her was give her umbilical cord stem cells. Now, let me clear up a couple myths about umbilical cord stem cells. First of all, they come from the umbilical cord. The tissue banks contract out with certain hospitals through the US, and any woman that's coming in for an elective C-section, cannot be an emergency, elective C-section, the hospital asks if she wants to save the cord blood or not. If they say no, they're asking if they want to donate the tissue to the tissue banks. If they say yes, then the woman is given a number of tests, both genetic and infectious-wise, looking for about 17 different diseases. The baby has to be born alive and healthy. The baby goes through the same testing. If it passes, that cord tissue and blood will be taken by the tissue banks, washed in a 5% of a solution of DMSO to kill any viruses or bacteria, stored at 160 degrees below zero, and those can be cleaned up and given to doctors to be used at their discretion in patients. A couple other things about stem cells is this. Umbilical stem cells have no HLA-DR factor. That means they can't interact. You can't have an allergic reaction. That's why you don't have to worry about testing, bone marrow or blood type and all that, because there's no HLA-DR factor. And just think, if you're a mom, you know your blood type. Very often the child's blood type is different than yours. In the real world, there would be a reaction and you would have a miscarriage. But because there's no HLA-DR factor, the way God designed it, there's no allergic reaction. So that's why you can give them to anybody. People ask me about the downside. I don't know of any downside to umbilical cord stem cells because of this. They go in and they look for damage and they repair. They did a study a number of years ago where they gave umbilical cord stem cells to a patient's shoulder. And 8 years later, they came back and they did sampling, could find no evidence of the DNA of the donor, because umbilical cord stem cells do not share DNA. They go up and they repair. I had experience with a lady that had a very bad third-degree burn, ended up at Tampa General Burn Unit, spilling hot cane sugar syrup all over her foot. She keloided up, real thick scarring on her foot, couldn't bend her toe, couldn't wear high heel shoes, couldn't run, couldn't work out because if you can't bend your toes, it's hard to work out, it's hard to walk, you can't run. What we did is we gave umbilical cord stem cells right there along the keloid scarring in that foot. 6 months later, you have to look very, very carefully to see any scarring at all, because umbilical cord stem cells turn scar tissue back into normal tissue. She's jogging, she's running, she's jumping, she's at the gym, she's wearing high heels, no problem. And it's very interesting. We did talk to a number of people who've had severe burns, and I'm looking at their burns that they've been at trying to get rid of that scarring. It's taken them 5 or 6 years to get anything close to getting some of the scarring to resolve. And with umbilical cord stem cells, 6 months later, and you're fine. Had a lady who had some back surgery, a number of back surgeries, and her back was no better. And they kept saying, we think it's because of all the scar tissue from all the surgeries. So we're going to go in and do some surgery and remove the scar tissue. And she said, but if you do that, you're just going to make more scar tissue. So she declined that. She came to us. We injected her lower back. 4 months later, perfectly fine. Scar tissue reverts to normal with umbilical cord stem cells. I've been using umbilical cord stem cells in ulcerative colitis and Crohn's disease. Very, very pleased. The patients are very pleased. I'm also very happy at the results, where they're off their medicines. They can eat a normal diet. They're back to where they were when they were a kid, because it remakes the immune system. Another great example of remaking the immune system is I had a lady that had severe latex allergy. On a scale of 1 to 100, 100 means you have no problems with anything. 1 is if you come into contact with one part of out of a billion of latex, you're going to have an anaphylactic reaction. You know, blood pressure drops, you stop breathing, you go to the ER. She was in the ER 3 to 4 times a week because near any type of latex, she would go into a reaction. She'd give herself a shot of the EpiPen, and she'd have 20 minutes to get to a hospital before she would go full flat anaphylaxis. We treated her. She came in from Oregon. It took us three treatments of stem cells, and it went from 1 part per 100, from 1 on the 100 scale, where 1 part of latex she's allergic to 84, which is basically normal. She can actually lick a latex balloon. She's not going to have any reaction, because you can use those umbilical cord stem cells to remake an immune system. Had a girl come in recently with cleft lip, cleft palate at birth years ago. She's 40 years of age. The repair, though, is falling apart. The bones that they pulled together, you know, at the upper top of the mouth, breaking apart. So there's a big valley there. The teeth are falling out. You could just wiggle them right in her mouth. They said, well, we can try to put some cadaver bone in there. May or may not work. It's going to be an 8 to 12 month process. She may not have any teeth by then. She came to us. We put umbilical cord stem cells there in the roof of the mouth, in the jaw. 3 weeks later, that roof of the mouth was perfectly back to normal. The teeth all tight in the jaw. We grew her jaw and the upper mouth back together with the umbilical cord stem cells. And I've had dentists send me patients where their jaw is disintegrating, and we've been able to rebuild it back just using injections of the umbilical cord stem cells around the jaw. Something that was just a very long process with cadaver bone. Really, it's not that difficult, and it's not near as painful. I have some other examples there, but I'm also supposed to talk about another subject. And what do I have, about 10 more minutes? Oh, Tiffany is being very nice to me. One of the, there's certain things that you like to treat. Like I love to treat strep throat in my practice because it's real easy to treat. I hate to treat strokes because once you've had the stroke, it is just, go to physical therapy and hope for the best. We're told the brain cells are dead. You've got what you got, and that's it. So I started reading about a drug called Umbilical, E-N-B-R-E-L. You've seen it advertised on TV for psoriatic arthritis. That's where you get a shot of Umbilical once a week in your arm, and it stops psoriatic arthritis. It's great. Umbilical is a very large molecule, and it will not cross the blood-brain barrier. So you can give it here, it'll never get into the central nervous system. So a group of doctors down in Fort Lauderdale experimented with Umbilical, and they put it into the central nervous system, right at the base of the neck. Went down about 1/8 of an inch just under the skin, because under the skin there is called the vertebral vascular system. It's a mass of blood vessels that were wrapped around the spinal cord, the brain, come out the base of the neck in the back, go right down the midline of the back. And I access it right there about C7. Then I put him head down, about a 45-degree angle for about 5 minutes. That system has no valves. That drug goes right into the brain. And when you stand them up, it's locked in. So I started doing it, and the first patient I did it on was a fellow that came in with post-traumatic stress disorder, depression, hooked on a number of drugs, very little mental capabilities. In talking to him, I said, how you doing, Bill? I am good. I could see I didn't want to ask him too many questions. So the wife was there, and she asked me, she would like to have him get Umbilical. We gave him Umbilical. I saw him a couple weeks later. How you doing, Bill? I'm doing great. Well, how'd it go? Well, after you gave me the shot, when I left here, I thought the top of my head was blowing off. I got home, and my wife said, you're talking really fast. She says, yeah, I know I am, but do I make any sense? She said, you make perfect sense. To make a long story short, completely different man. That was about 3.5 years ago. But the other interesting thing is this. He says, John, I've never had my mind work so fast in my life. I can look at a sheet of figures and say up 4.2%. It's almost like a photographic memory, you might say. He says, it is just amazing how fast my mind works. I had another person who came in with a stroke 6 months earlier. He's a carpenter. It's hard to be a carpenter when your right leg and right arm don't work and you're partially blind. He came in, we gave him Umbilical. Next day, vision's back, right arm, right leg are perfectly normal, and he's back to work. Things that we are told by the medical community cannot happen is happening. Because with Umbilical, you're stopping the inflammatory cycle that's going on in the brain when you have any type of brain problem, be it autism, stroke, severe depression, schizophrenia, Downs, you name it, there's always an inflammatory aspect. And Umbilical, in 70% of the time, it's not 100%, stops that, and it's a one-time deal usually. Spinal stenosis. Had a lady the other day. Surgeons don't want to operate on an 80-year-old lady with spinal stenosis, even though she's in great pain. Came in, gave her the Umbilical, right over the area of the spinal stenosis, put her head down for a few minutes. Pretty happy lady the next day. Had a guy I did it 2-3 years ago. He's still fine. So Umbilical has been very, very good in our practice. We've also combined it with stem cells because Umbilical works central nervous system. I use the stem cells for like disc diseases and things like that. But it's really revolutionized medicine in areas that really we didn't think we could really make any progress in. Strokes, Downs with my own daughter, huge difference there. Autism. And basically, it's an off-label use of a drug that's approved for something else that we use off-label uses for drugs all the time. I'm going to take all the way to Tiffany's time, but if you think of some questions, you can email it to Maria and Tiffany, I'll answer them later. But I hope it's just giving you some ideas that a lot of the things that your doctor may say, oh, get used to it. You're done. Just get used to living like that. It may not be true. So Tiffany Barber is the newest addition to the family. She is the nurse practitioner extraordinaire along with Alex. She does a lot of the platelet-rich plasma. She does all the other stuff that Alex and I do. And we've just been so busy. We were growing our practice. So Tiffany is coming, and now you're getting booked up. And so, well, you know what? I thought we cured sickness and disease in Pinellas County. I guess they'll have to hire someone else again. But without further ado, Tiffany, it's all yours.
Take it away. Well, I hope that I'm as dynamic as Dr. Young, because he is. I could listen to him all day and learn from him all day. So I appreciate his knowledge and his wisdom and sharing that with all of us. I'm sure all of you agree. So I've been with the practice now almost a year. I came from, and I know you can read this on the website, but I'll give you a little bit of background on me. So I came from the orthopedic world. I spent 10 years at Morton Plant Hospital working in orthopedics. I studied with the lead orthopedic physician at Morton Plant Hospital in his office and in the OR, doing hip and knee replacements, cortisone injections in the office, and just really learning that really great field of orthopedics and the things that they do in Western medicine. So with that long tenure of 10 years in the hospital and seeing how we treat arthritis pain and hip and knee replacements when there are problems, I also had a lot of problem with the fact that we were giving these patients cortisone injections into a joint, knowing that, and I know you at home can understand that when we have long time doses of prednisone or steroids, the doctor should and always tell you that you have a huge risk of osteoporosis, right? Long-term use of steroids. Well, why are we concentrating that steroid and putting it into a joint and not telling our patients, hey, this may cause some bone disruption, some joint disruption in here? So I was seeing that we were giving cortisone injections in joints and then seeing these same patients come back and now their joint has been eaten away by the cortisone injections. Oh, gee, now they need surgery for a hip or knee replacement. So, you know, me using common sense, I'm saying something's not right here. Why are we setting patients up for failure? We really need to be healing the area and making sure that they do have reduced pain and reduced inflammation. There's got to be a better idea or a better way to do this. So I started researching on my own, you know, what are the alternatives to doing this? And I came and I found PRP. So looking at Dr. Young's website, I was reading a lot about PRP and how that uses our own blood and our own plasma to heal that area, just as he was talking about stem cells. You know, we're drawing your blood, we're taking your plasma, we spin it in a centrifuge, we use that really protein-rich plasma or platelet-rich plasma from the top of that tube, and we inject it back into that area that's giving you the pain, that's giving you the trouble, And I see a lot of patients. I'll even tell you, I treat my own mother and father here because my mom came to me one day and said, my hip really hurts. I sent her to what I thought was the best orthopedic surgeon at Morton Plain Hospital. And he told her, you're too young for surgery. Here's some cortisone. And I said, oh gosh, what did I do? So she suffered in pain for a long time. They weren't really helping her. And all of a sudden I said, why don't you come and see me? Your daughter does this for a living. Come and get some PRP. So she comes in, it was about October of last year. We did PRP in her right hip where she had a labral tear. So, and the doctors will tell you too, labral tears, they don't heal. You'll never heal. You'll just have to go in surgically and get that done. So first injection, she has PRP. She goes home. She tells me, yeah, I feel a little better, but I don't know, kind of sore still. And then she tells me the next day, Tiff, you'll never believe it. I got out of bed last night. I shot right out. I got up, I went to the bathroom, I came back to bed, and then all of a sudden it hit me. How the heck did I get out of the bed so fast? And then back in bed without having to do the sit on the edge, think about it, walk, crouched over a little bit, stretch a little bit, limp for the first 3 steps, and then get going. She said she popped right out of bed and grabbed. So, and if you get PRP with me, you know that I share this story with a lot of patients that my mom was the one-shot wonder because she got 1 injection and she felt amazing. And that's just, proof in the pudding that we have the healing ability in our own bodies. We just have to make sure that it gets in the right place. So I am seeing a lot of patients that have sports injury tears. I have triathletes that come in and see me. I have cyclists that do 100 miles, time that they're out cycling, 100 miles a week at least, that are out and they have some meniscus tears. And I also just added on a Olympic level whitewater kayaker that is now getting PRP with me as well. And it's very successful. They come in for their treatment. They follow up with me and say, hey, I don't think I've ever felt better. Let's keep doing this as a maintenance just so I can keep up with it, especially since I'm playing sports and I'm using these joints and I'm really seeing a difference. So it's really, really interesting to know that I went from a Western medicine perspective of loading up cortisone in these people's joints and these areas of pain and doing more damage than I was really helping them. And now I have the ability to go in and actually add that fertilizer for that healing to really happen. And it's an amazing thing. And it makes me feel very rewarded to see that I have these patients come back and say, hey, you changed my life. I feel so great. And I can't believe that, I'm now able to do things that I couldn't do before. So it's really neat. We also are doing PRP, and I don't know if you've seen the emails go out or the specials that we're running since February. And I have a laugh at my right. Since February that we're doing intimacy shots. So I have patients come in and tell me, hey, Tiffany, I'm having trouble. I have urinary incontinence. I sneeze and I urinate, or I laugh and I urinate, or I can't hold it. I have to go. And the minute I think that I have to go to the bathroom, I'm already going when I'm on my way to the bathroom. And that's just poor quality of life. If you're living like that and you're having to wear, panty liners or something in your underneath your pants just to make sure that you don't have an accident, that's absolutely no way that we need to be living. So Dr. Young and I did some research and we found that there's actually great results in PRP when you inject it in the vaginal wall and around the urethra. And so we have patients that have come in for this treatment and they come back within 4 weeks and say, I absolutely have no more urinary incontinence. I actually have no more vaginal dryness. And I have more of a sexual desire than I did before the treatment. So we're getting more benefits than what we really planned on with these injections, but we're seeing some great things with this, and we're adding people onto our schedule every day for these great things. So I'm just really excited to be here, and I'm excited to do these treatments with PRP. And I hope you guys can come in and see me, and we can talk about any aches and pains, and if you have any urinary incontinence or any dryness, then we can take care of that too. I don't know if Dr. Young wants to come back up here and do a jig.
So, are we going? Can we open it up for questions?
Yeah, they can chat in if they have any questions.
All right, so if you have any questions, what do they do? Just type it in,
Yes, yes, they can just chat it to us.
chat it to us, and
We'll answer what we can.
we'll answer what we
Mhm.
can. It's a freebie, so take advantage. But it's just, with Tiffany and Alex and I, we talk early in the morning. And, I think one of the big things that we do in this practice is this. In most practices, well, here's our AMA approved protocol. You do the protocol, and if you're no better, well, you see a specialist. Specialist, he goes as far as he can. If you're no better after that, then maybe you're depressed. In other words, or get used to the pain or whatever. And we're usually the place of last resort.
Yep.
So it's kind of, if you want to work here, you have to be the type that's willing to say, all right, what can we do? Thinking outside the box, going back to basic biochemistry and physiology. And I've noticed that there's things that I've been flummoxed on, and then 6 months later, you'll do something. That's the answer. So, I find if you don't get better from us, then maybe in 6 months check, because there's always about every 6 months
Something
some
new.
big changes in our
Yeah.
practice. All right, we have some questions. What's the approximate cost for both procedures? I think you're talking about platelet-rich plasma.
Yeah, I think we get in trouble a lot because we quote people the wrong price. So we'll have Maria get back to you if you want to shoot her an email and get prices for things that you're interested in, just to make sure that we're accurate in that.
Because with the PRP and even with the platelet-rich, with the stem cells, there's different additives or different ratios we can do. And it also can depend on what joint. Certain joints you don't need as much and things like that. So I think the best thing is talk to Maria, and she will get a little more information from you, and then she can tell you exactly how much it would cost. All right. I can say, though, I will say for the Umbilical, if you want to go down and get Umbilical from the people that first did the study down there in Fort Lauderdale, it's $12,000. Here it's $1,900. So same stuff.
I mean, we always try to be very fair with our prices too. I know there are people in the area that are charging, what was it, $800 we read per PRP injection. So if you came in and got your knee injected and your shoulder injected, that would cost you $1,600. That is definitely not what we would charge you here. So we are very competitive. We're very fair. We're always going to be, because we want you to get better. We're not in this for the money. Otherwise we'd be millionaires somewhere else. Dr.
Have you done any work with atrial fibrillation? You want to answer that first?
I think that's a good one for you, especially with stem cells.
All right. So yes, we have. I think a couple of things. One is, I think with atrial fibrillation, one of the first things I like to do is start them on iodine, because iodine tends to regulate the heart's electrical system. The other thing is you want to make sure that thyroid is working properly, because atrial fib is a sign of low functioning thyroid. So there's a number of things to look at to try to get you out of AFib. Next question, Dr. Young, I had PRP on my right knee about 10 years ago with you and have not had pain since. All right, we need to send you a bill for 9 years.
Prolonged help.
However, I do need to take care of my left knee and back. All right. Well, I think you're going to be calling Tiffany and getting her to inject you. Listen, she has done so many that I think you've done more than me now.
Oh, gosh.
Yeah, I mean, I still do them, but Tiffany is the go-to girl. Since the stem cell treatment can help with things in the brain, would it work to mitigate brain-centered tinnitus? Or maybe I need the Umbilical. Okay, couple things.
It's a good question.
Tinnitus is a tough one. Do you want to add anything or say anything?
You start because she's very specific.
Okay. So, I've used some Umbilical for that. 50-50 results in that. Lately, I started giving stem cells like I do Umbilical on the vertebral vascular system at the back of the neck. And I'm getting some reports back from the patients that it's making a difference. I haven't done many, but that's what we're looking at right now, and that may be a possibility.
I know supplement wise, they've been doing a lot of research on high doses of vitamin C and zinc, but I wouldn't want you at home to just start taking high doses of vitamin C and zinc. So not knowing what the cause of the tinnitus is, we need to explore what caused it, because you don't want to just put Band-Aids on things, right? We want to make sure we get to the root of the problem. So I think that's really going to be one that you're going to have to come in and see us, and we can talk more in depth about what the cause could be and then the different routes of treatment for that.
Let's see, any others?
I think they're scared of us now.
We have very highly educated patients, so they know a lot of this.
Yeah, they're very scared.
This is going to be available. They can pull up at any time
You can
off
send
the
it.
web or
Hold
whatever.
on.
So from what I understand, the stem cells with the PRP has been working faster than just PRP. I think that's probably very true. Yeah.
I think it also depends on what's your injury or what's your problem, right? Is this arthritis? Is this a tear? Is this something we can clear up easily with a couple rounds of PRP versus doing, stem cells? So just depends on really what's going
Right.
on there.
Jaw was removed for cancer. Can it be replaced? All right. There's going to need to be some bone there. If the whole jaw is removed, probably can't do much. But if there are sections of that jaw, probably can grow that back with stem cells.
Right.
All right. Well, listen. Oh, wait, here. Wow, what about teeth? I've read in the literature that it's happened. I have not seen it happen. I do know that it does tighten people with loose teeth. That takes 3 weeks, and that jaw just clamps right around those teeth, and they're very tightly back in place.
It really strengthens connective tissue. I think we've seen a lot of that, in our patients with the connective
Right.
tissue difference. Yeah.
So, but I thought about that years ago, but I haven't seen it. But there is I read an article in the literature, but I've never seen it in my own practice.
So, what I also haven't talked about either with the PRP, and I think about this earlier, was I've started doing PRP for hair loss. So I have patients coming in that have, the either menopause caused hair loss, or they had COVID and now they have hair loss. And so we've been doing a lot of scalp PRP here too. And for the last 6 months, it's been long enough for me to see some results. And I have people that are actually having some hair growth back by putting the PRP in the scalp. So that's also something to think about too, if you have any of those symptoms.
I guess my family, there's just too much hair.
You have the best hair.
Any success with tinnitus? Well, we're having some, but I need to do more patients before I can tell you it's worth doing. I just don't know.